When the pandemic started, frontline workers like respiratory therapists faced new challenges and constant changes that often redefine what their typical day would look like and how they cared for their patients. RRT Randy Loo from the VA hospital near Reno, Nevada, shared his experiences as a team leader, treating respiratory patients, and working with other professionals during the COVID-19 pandemic. Bundled care, limited PPE, evolving patient care criteria, and critical care are all a part of his typical day right now.
As a respiratory therapist, it's really important that, again, we are able to maintain our patients and make sure that they get the very, very best care. Typical day, as far as right now in these particular times, is really treating our COVID patients, especially the ones that are mechanically ventilated. And those patients that aren't mechanically ventilated, we try our best to minimize the care as far as our respiratory therapy procedures, because again, part of the danger is aerosolizing some of these particles, especially in these kind of very ICU or intensive care type of patient, right? So the type of patient I'm talking about is that one that is mechanically ventilated. And one of the biggest things is, again, dealing with humidification and dealing with therapies that ordinarily would do without a second thought. And now it's taking our time, being very, very deliberate in what we do for these particular patients. For right now, I guess it's a waiting game as far as what is truly working, because what I've encountered so far is kind of we're trying to rush and figure out what's going to work best for a particular situation. Let's take a intubation, for instance. It's very difficult to nail down a specific procedure that's going to absolutely work without testing it ahead of time. And part of the problem with that is these patients aren't going to wait for you. They're simply going to show up, and you're going to need to do it right then and there. And we've, again, encountered where we're trying to do the very best, and as we go through this process, we try and figure out what works and what doesn't. And we try and get those things that don't work out of it. Certainly, right now, PPE is the biggest thing on our minds, and right now what we've been told is we only have the PPE that we have. So if, in my particular case, I have to use a capper or a PAPR, and I get one hood. And that's pretty much for the duration, at least until I can demonstrate that that hood is no longer effective. Visible tears are pretty much the telltale signs that it won't work anymore. So I have to, again, go to the nursing supervisor to be able to demonstrate that. But again, if we're following all our policies, procedures as far as how we clean these things, and granted, these PAPRs or these PPEs weren't necessarily intended to be reused as much as we're currently doing them, but we're doing it to, again, to minimize the amount that we're actively using while being safe at the same time. Certainly, it's a really, really stressful time, and a lot of the nurses that I work with, certainly they are feeling the toll, right? Because when we're caring for these patients, we're having to go in the room and we're having to dedicate a whole lot of time. So we're trying to do bundled care as much as we can, so that way we kind of minimize our contact as when we go into the room and be as efficient as possible while delivering the best care to that patient. So when we come out of the room, and certainly it's a debriefing and making sure that each other are taken care of, but definitely having conversations about how we can do things better, what we're going to do in the time frame. Certainly for me, I think this is more not necessarily what I truly signed up for, but I signed up to take care of some of the sickest patients. And this is really what I wanted to do. I wanted to be able to, again, ensure that these particular patients get the very best care. And if I could do it safely, and if I continue to follow all our policies, procedures, it'll always be that way.